Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we are here with the Oxygenation Part 3 video. In last two videos we have already discussed about the anatomy of respiratory system, the factors affecting the respiratory functioning and the self-care behaviors for promote oxygenation and also the different methods of oxygen administration along with its advantages and disadvantages. Let's see today's video. In this video, we will discuss about the hazards of oxygen inhalation and the nursing responsibilities during oxygen administration. Let's start with hazards of oxygen inhalation. First is infection. Infection may occur because of use of contaminated equipments which are used in oxygen administration. Next is combustion. As oxygen is a combustible substance, so fire is a potential hazard when oxygen is administered. Next is drying mucous membrane and respiratory tract. If oxygen is administered without sufficient humidity, it causes drying and irritation of mucous membrane. Next is oxygen toxicity. Oxygen toxicity is a condition which occurs due to inspiration of high concentration of oxygen for prolonged period of time. Oxygen concentration more than 50% over 24 to 48 hours can cause pathological changes in the lungs. It causes tracheobronchitis starting as a tracheal irritation and cough. Then it is preceded by dryness and irritation of mucous membrane, substernal pain, nausea, vomiting, formation of a membrane similar to hyaline membrane on the alveolar valve, which causes dyspnea. Next is atelectasis. Increased oxygen concentration in the inspired air leads to depletion of nitrogen. As the nitrogen helps to keep the alveoli expanded, so the deflation of air sacs can occur. And this condition is known as atelectasis. Then oxygen-induced apnea. We all know apnea means cessation of respiration or absence of respiration. Since carbon dioxide is washed off completely from the blood by high concentration of oxygen, the respiratory center is not stimulated sufficiently, which leads to cessation of respiration or apnea. And the last one is retrolental fibroplasias. Oxygen therapy may affect the eyes, especially in infants. High concentration oxygen develop fibrotic changes behind lens, which impairs light penetration to retina. Next, coming to the nursing responsibilities during oxygen administration. Oxygen is a therapeutic gas and must be prescribed by physician. Check the identification data of the patient and physician's order before oxygen administration. Confirm the diagnosis of the patient and need of oxygen therapy. Assess patient's breathing pattern, cyanosis and oxygen saturation. And always check that oxygen is properly humidified by checking the humidifier and the water level in the humidifier. Sterile equipment should be used to prevent infection. Oxygen is a highly combustible gas. It can easily cause a fire in patient's room if it contacts spark from an open flame or electrical equipment. That's why place an oxygen in use sign on the door of patient's room. Smoking should not be allowed on the hospital premises. Determine that all electrical equipments in the room is functioning correctly. And when using oxygen cylinder, secure them that they do not fall over. Store them upright and either chained or secured in an appropriate holder. Check the oxygen level of portable tanks before transporting a patient to ensure that there is enough oxygen in the tank. And pay attention to kinks in tubing, loose connection and faulty humidifying apparatus as it may interfere with flow of oxygen. And place a call bell near to the patient so that patient can call you whenever is needed, and discontinue oxygen therapy gradually as per doctor's order and monitor for toxicity. If this video is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.